All right, let's go ahead and get started. But good afternoon, everybody. I am Dr. Brown, the Associate Dean of Undergraduate Pharmacy Programs and Pathways. But more importantly, for you guys, I'm the advisor for the APEX program. So I will be working with you for sure the first 2 years, and even for like until now, until the classes start in the fall, if you decide to come to Chapman University. So this is a info session just for admitted students. I do have some information to share for those of you who've done one or more of the virtual info sessions for just general students. You'll see some similar information there, but I like doing this session for admitted students just to be able to give you guys mainly a chance to ask questions that you might need answering to kind of either help you with your decision or solidify your decision or what have you. So I am going to go ahead and share my screen. All right, here we go. So I think you guys can all see the screen. So if you haven't been to a session with me before, just a little bit about me. I have been at Chapman since 2013. I came out as the inaugural Associate Dean of Student Affairs over the PharmD program, and have enjoyed being able to mentor students and bring students into the PharmD program. Then I did 3 years in the provost office, helping run the university due to my healthcare experience, and then came back and started this role back in 2022, working with the Apex students. But I have been around pharmacy for a long time. I started as a pharmacy tech in the Air Force back in 1985, did about 5.5 years there before getting out and going to school part-time and working full-time for Kaiser up in Northern California, but got my PharmD degree up at University of the Pacific, and then loved pharmacy so much that I continued on and got my PhD at the University of Minnesota in pharmacoeconomics and health policy. Then spent 10 years at University of Tennessee as faculty before coming out to Chapman. But been around, done a lot of stuff, know a lot of people. So I'm a huge resource for both the pre-pharm students and the pharmacy students. And speaking of the pre-pharmacy students, just to let you know, this is our class of 2030. They started last fall, and we are up to 62 students in our Apex cohort. We've grown a lot over the last few years, just a lot more qualified students that have been applying to the program. And you can see the average weighted GPA of that class is 4.03. And so obviously you guys know that Apex program really focuses on bringing in top tier high school students. So as a review, our program's called a 2+3 program. That means you do 2 years of undergraduate coursework, and I'll show you the classes in a second. And then you'll do the 3-year PharmD program out at the Rinker campus. So the 2 years are here at Orange, and that's a regular fall, spring type of a situation. When you get to Rinker campus, that's going to be trimesters. So you'll have fall, spring, summer, and then fall, spring. So 8 semesters, we call them trimesters, but 8 ones. You'll have like a 2 week break basically between each of those trimesters, and they're all 15 weeks. So it's not like it's accelerated in that the semesters are only 10 weeks long. It's the normal 15-week semester. The nice thing about being in the Apex program is that you get guaranteed admission into the School of Pharmacy. There are some caveats to that. Obviously, you have to remain an Apex student for that guaranteed admission to take place. And I'll talk to you in the next slide about how you maintain your Apex status while you're in the undergraduate years. But the really nice thing is that you get guaranteed scheduling of all your necessary classes. So you get a seat in all your classes that you need to keep you on track and so forth. Now, there's two caveats there. One is that um, you get a guaranteed seat. You don't necessarily get the most convenient time for your class, right? So if there's a 8 a.m. class that has a seat available, you'll need to take the 8 o'clock seat. If there's a 6 p.m. lab that has seat available, you'll need to take the 6 p.m. Class. So that's the one caveat. If there's an open seat, you have to take it. Because I can't go to the department chairs and ask them to open up seats in a class because they're going to say, well, wait a second, there's a seat already available, right? So, and that's worked out fine. Some semesters students get like really great schedules. Some semesters students might get one that's less convenient, but you do have a seat in the class. The other caveat there is that you have to enroll in your classes on your date of enrollment. And so you can't like blow it off and wait a week or two and then say, oh, Dr. Brown, like there's no seats left in the classes. Can you put me in the class? So you have to at least get on the wait list, or if all the classes, or if a class is closed, notify me so that I can put you on the list to get you a seat in that class. And then there is the additional Apex scholarship of $44,000 for the Farm D portion of the program. And that scholarship is for um, the whole program. So it's about $5,500 per semester that you would get. It's not 44,000 per year, unfortunately. All right, next slide. So how do you stay in Apex program? Like, I'm sure many of you are looking at this and laughing and saying, man, this is like so easy, right? Like, why is it that you only need a 3.0 GPA, can't have a grade below C in any prereq class, and have no semester GPA below 2.6? Like, with the way that you've done, how well you've done in high school, vast majority of our students have no problem with this. And in fact, you'll see some slides later, even though this is our minimum requirement, the average GPA for our Apex students in their undergraduate years is 3.6, right? So it's not like students are saying, "Oh, I'll just take it easy." They're still very engaged and trying to do as well as they can in the undergraduate years. Now, if you end up with a semester GPA between 2.6 and 3.0, then you're allowed to go on probation for the next semester. And as long as you get a semester GPA high enough that you're over 3.0, obviously, that your overall GPA is also over 3.0, then you keep your Apex status. You do have to complete all prereq classes for a letter grade. That means you can't take a class pass, no pass. It has to be for a letter grade. And you have to take a minimum of 13 credits. So even if you come in with a bunch of credits from AP, dual enrollment, community college, you still have to take a minimum of 13 credits per semester. That's not a huge deal because to be a full-time student and get your financial aid, you have to take 12 credits per semester. But we require one additional credit for Apex students each semester. And that's just for the first 2 years of the program. And you have to complete all 61 credits by the end of the spring semester of your second year. And you can't take more than 4 credits of prereqs outside of Chapman after starting the Apex program. You can have, however much you want before you start Apex in the fall, but once you start at Chapman undergrad, the most you can take is 4 credits outside of Chapman. That's a prereq class. And then you have to apply to Chapman through PharmCast, which is kind of like the pharmacy's version of Common App. And you'll do that by August 20th during the summer between your first and second year, and then excel in the interview that you'll have in early September for the pharmacy program. Now, that interview, that's another benefit because your interview day would be for the Pharm D would be Apex only. So that means only Apex students would be interviewing that day. So all the faculty know that you're all Apex. They know that you already have guaranteed admission. However, you still need to take the interview seriously. That means dressing professionally, acting professionally, being engaged, doing as well as you can, right? Because you can't come in and be like, oh, you're like, I know I'm already in, so why am I even here? Like, you're still required to do well in the interview. If you don't we'll just make you interview again. So you might as well just get it done the first time and do it right, which again, the vast majority of our students have no problem doing well on that interview day. Now, let's say you don't meet all these requirements, like if you get a grade of C minus in a class, and so you get dismissed from Apex, but you're still in Chapman University. And as long as you didn't just completely crash and burn and you have like a really low GPA, you can still stay as a pre-pharmacy student, still stay as your advisor, still help you get into classes. And the vast majority of students who do get dismissed, and there's not a lot that do, but those that do, the vast majority of them still complete their classes and have a GPA good enough to get admitted. Now they lose their guaranteed admission, so they got to make sure that their GPA is like 3.0 or higher for when they're applying to the PharmD program. But yeah, it's still possible to complete in 2 years and stay with your cohort, even though you won't be Apex any longer. Let me stop there and see if you have any questions. Okay. Excuse me. Seeing none, we'll go ahead and keep going. So when I was talking about the classes, well, first, one other thing. As an Apex student, this is very important to remember. So you will not be a bachelor's degree seeking student. You will be an Apex pre-pharmacy student. As such, you will not have any GE requirements. You won't have any language requirements. At Chapman, we have a freshman foundation course that all bachelor's degree seeking students have to take in their first year. You won't have that requirements. Like your requirements will be the classes that I show you on the next slide, just your pre-rec classes. So that solves a lot of problems of having to figure out what you need to take. So these are the classes that you will be taking if you haven't already completed some. So in the fall of the first year, you have Bio 204, which is general biology with lab, Gen Chem with lab, calculus, comm course, which is speech. And this comm course, English, psych or soc, the stats, econ, these electives, those can be moved around into any semester. We just had to put them somewhere, and typically like stats and econ are in your last year. But if you want to take English that first semester instead of comm, you could, or if you want to take psych or soc that first semester, you could. And I meet with each student during the enrollment period to make sure they know which classes they should be enrolling in and which classes they've completed. So you never have to worry about, oh, like, am I enrolling in the right class? Because I'm meeting with you and going over the classes so you're well aware. And then the Farm 100 is the other class. The spring has genetics, Gen Chem 2 with lab, anatomy with lab, and then English or one of the other 3 credit courses. And then fall of the second year is microbiology, no lab for that one. OChem 1 with lab, stats, psych or soc, and your required elective. And the required electives can be any 3 credit course except a 100 level math, biology, or chemistry class. So pretty much anything that's out there. We talk about either language or music, arts, or a liberal arts type class. And then your last semester, you have physiology with lab, OChem 2 with lab, econ, either micro or macro, and then intro to pharmacy 200, and then your last elective. So you can see if you don't come in with any credits, any class is already fulfilled, you'll have 15 credits each semester except for the fall of the second year where you'll have 16 credits. Now, a couple of things about the classes. The Farm 100 and Farm 200 classes, those are Apex only classes, as are the microbiology and physiology with lab. Only Apex students will be in those classes. The other classes, you'll be mixed in with some Apex and some just general undergrad students. For the Farm 100 and Farm 200, those are career exploration classes. And so basically, I bring in about 13 different types of pharmacists that will come in and talk about what they do, how they got there, like what path they followed, and give tips if you're planning on or interested in possibly going into that area. So it's really for you to learn about different areas of pharmacy, some of which may pique your interest, some you may be like, I'm not interested in that, right? But it's to expose you to at least some of the different things that a pharmacist can do. There's over 180 different jobs that pharmacists have out there. So you're only going to be exposed to about 26 of them. But that's more than a normal undergrad student in pre-pharmacy would be exposed to because they don't have that class. Now, some of you are asking about APs. So here are AP scores. Biology, you need a 5, even though Chapman only requires a 4. Apex students have to have a 5 to AP out of biology. Calculus AB is a 4, BC is a 3. Stats, macro, micro, and English Lang are all 4. And that has to be English Lang, not English Lit. And then psych is only a 3. So you might ask, well, what if I AP'd out of biology? Then you would take genetics in the fall instead of biology in the fall. If you AP'd out of calculus, you would take stats in the fall. And so you're able to move classes forward and so forth. If you have so many classes that, fulfilled, so let's say you have calculus and biology, that semester you'll be moving classes up. But let's say this semester you already fulfilled genetics, so you just have Gen Chem 2, anatomy with lab and English. Well, that's only 11 credits, and you need a minimum of 13. So you would just add in a 3 credit course, so one of your other classes. So to fulfill the minimum of 18 credits. So let me stop there and see what questions you guys have. No, students, the question was, will students have to take summer classes? No, you have fall and spring semesters where you have to take classes and be a full-time student. We also, I will be talking about this in a second, we have an interterm at Chapman, which is the month of January. And so you can take a 3 credit course during the month of January. Unfortunately, there's not many classes that Apex students need. I think there's a stats class that's offered and maybe one elective that's offered. But those classes meet for 3 credit class, it meets 3 hours a day, 4 days a week for 4 weeks. So it's kind of a accelerated course. IB courses, yeah, we do accept IB. The scores that you need are a little bit higher, obviously, because it's IB rather than AP. If you took IB courses and want to know if they would meet our criteria, then just let me know. We do have a website that has the IB scores. The only one that would be higher would be biology. All the other IB scores would be the ones that are up on the website. And I think the biology is a 6 or 7 that's required for that. And it's got to be, the IBs have to be high level. We have another question. If I AP out of both calculus and stats, yeah, we do have students that have done that. So if you AP'd out of calculus and stats, then you would like take comm and English or comm and elective or English and elective. You would just fill in with another 3 credit course. And again, the good thing is I want you guys to have to worry as little as possible about all of the class stuff. I want you to be able to focus on your studying and your socializing and getting to know the other PIC students. So, as I mentioned, I meet with each of you, and so you will know for sure like which classes you can fill in to be able to get your minimum credits. If I've taken dual enrollment classes at a community college, as with Golden West, right, can they clear some of these? Have taken sociology as dual enrollment. So, very good question, Dina. For your dual enrollment classes, what you'll need to make sure you do is like after you make your deposit, you want to make sure that those community college transcripts, the official transcripts, are sent to Chapman, preferably electronically through like Parchment or whatever system your community college uses. And when the registrar's office here at Chapman gets it, the transcripts, they will review them and they will look to see which classes fulfill Chapman classes and give you credit for those classes. So if you took sociology, like one at Golden West, I don't know if that's the number, but and that is equivalent to our Soc 101, then it would show in your unofficial Chapman transcript that you fulfilled Sociology 101, and you wouldn't have to take Sociology 101. During the summer um, is when your enrollment as a first year student, it will be in July, but in like late June, I'll be having my one-on-one meetings with each of you, and I would have already gone through your unofficial transcripts for Chapman to see which AP courses, AP exams have fulfilled courses, as well as which community college classes have fulfilled courses. And we'll have that in my spreadsheet, and we'll be able to let you know for sure which courses you have fulfilled and which one you still need to fulfill. But good question. Took psychology at a community college during the summer. Would I have to take it again at Chapman? So that's the same question or same answer as I previously stated. The main thing is you have to have your community college transcript sent to uh, Chapman and have the registrar's office review it and then see if it's equivalent course or not. Most likely, the psych, if it was like an intro psych class, most likely it's going to fulfill Psych 101. The challenging ones are like some biology classes, chemistry classes, although you have to take chemistry here. Um, but biology, sometimes it's like an intro to biology, and students think they fulfilled the biology requirement, but that wasn't really Gen Bio. It was kind of like a entry level bio to kind of get you ready for biology. Same with anatomy. Sometimes there's like an intro to anatomy that's not really the full anatomy course. So that's why the registrar's office knows which classes will fulfill and which ones won't. Is it possible to start Apex spring semester instead of fall? Are you talking about this spring semester or spring of 2027? Well, actually, it doesn't really matter because the answer to both of them are no, for sure for this spring, 2026. Uh, for spring of 2027, it's technically no, but we do have students who don't get into Apex, but they get admitted into like health science bachelor's degree program or biochem program or chemistry or biology. And as long as they take biology, chemistry, calculus, and the FFC course in the fall, then they can petition to be able to uh, change majors to Apex. But basically, we go back, look to see if their high school record was good enough for them to have been admitted to Apex. And then we look at their fall performance and make sure that it's what a typical Apex student would do, which is basically, uh, you know, mostly A's and possibly one or two B's. So we do allow students to change. But if you're wondering, can you be accepted as an Apex student, deposit as an Apex student, but not start until spring of 27 or try and start early in 2026? Yeah, there's no possibility for either of those. All right. Looks like we have all the questions answered so far. So let me keep going. And if you have other questions that come up, definitely let me know. Okay, so this is important information for you if you deposit and you're going to start with us in the fall. At Chapman University, for first year students, also known as freshmen, we use a block scheduling process for the first fall enrollment. After that, you'll have to enroll in all your classes yourself. But for the fall semester, you will be automatically enrolled in a section of general biology with lab, gen chem with lab, calculus if you haven't AP'd out of calculus, and Pharm 100. So the only class you'll have to actually enroll in yourself would be a COM or English or psychosocial, whatever 3 credit course you want to take to get 13 or more credits. And so the nice thing about that is you will not have to stress about whether you got a seat in classes for the fall, because you already have a seat in a class. You already know your schedule before you even enroll in the one class that you have. So you'll be able to know what days and times your classes are, whether it's Monday, Wednesday, Friday from 9 to 9:50, or Tuesday, Thursday from 8 to 9:30, right? And so you'll know where your gaps are in your schedule, and we'll be able to then fill in with that other class. And like I said before, I'll be there to help you figure all of that out. All right, so I already talked about you can take up to 4 credits, and that's for free. You don't have to pay tuition for interterm. If you took a summer class, you do have to pay tuition for that. And I already talked to you about this, but the thing to stress is if you decide you want to take a community college class, like over the summer or during interterm, um, you have to get approval from me before you actually register in the class. And this is for your protection. This is not me trying to dictate things to you, that this is for your protection. Because the last thing you want to do is go off on your own, think that a class will fulfill one of your classes here, one of the prereq classes, pay the money for it, finish it, get a good grade, and then have me tell you, sorry, like that class isn't equivalent, right? So it's for your safety to make sure you're not wasting your time taking a class that doesn't fulfill one of your prereqs. And then the other thing, which I'm not sure if you're interested in international travel, but next year, this summer, I'm going to be offering the first 2 week summer travel course just for Apex students. And so 2027, we'll be doing it again. And this will be a course on pharmacy in Europe, where we're going to be visiting Hungary, mostly Budapest is where we'll be spending our time. And then we'll be taking a day trip over to Vienna, Austria, because it's only like a couple hour train ride from Budapest. I've been going to Budapest every year pretty much since 2003. I go to speak at a conference over there, and it's a fantastic country, fantastic city, great food, and a place that not many people would normally think about going. But once you go, you'll see how great it is. The other great thing is that all Chapman undergraduate students get one free 2 week summer travel course. And so normally for summer classes, like I said before, you have to pay tuition for summer classes. But for a summer travel course, you can get a waiver to waive the actual tuition fee. Now, there's obviously a fee for the course itself. It's around $4,000, which covers all of your transportation inside the country, like once you get to Budapest or to Hungary, um, and like some dinners, some lunches, some breakfasts, um, hotel, right? And then all the different excursions that we'll have. So that's all for like all the stuff that you'll be doing when you're in country. Um, okay. All right. So someone asks for explanation of the block schedule again, and sure, I can take a second to do that. So So let me explain normal registration first, and then I'll go back to block scheduling. So let's say, imagine we're in the fall, like around November. You will be assigned a registration or enrollment window date and time. And so it might be on like November 15th at 6:30 p.m., right? And before your window opens, we have what's called a shopping cart period. And in the shopping cart period, you would go in to the student center system, go and search for classes. And so let's say for this spring, you would search for Bio 208, which is the genetics, right? And you would find one on a day and time schedule that you like, and you'd put it in your shopping cart. It's kind of like on Amazon, right? Where you go through, you put stuff in your shopping cart, but you don't own it until you actually pay for it, right? The way it works with enrollment, you put in your shopping cart, but you're not actually in that class until your enrollment window opens and you actually enroll in that class. Makes sense? So you would go through, you would put in, a section of genetics, which is Bio 208, section of Chem 150 lecture and the lab, and then the HSC 210, which is human anatomy, and that's a combined lecture lab. So you just put that one class that'll have both sections in there, and then whatever other 3 credit course that you want to take in the spring. So you'll put those in your shopping cart. Personally, I recommend putting multiple sections in your shopping cart because when your enrollment window opens, you want as much chance that you'll have a section that still has seats available in it, right? If you're enrolling at the very beginning of the enrollment window, it's usually a 3-day enrollment window. If you're enrolling at the beginning, you've got pretty good chance of getting the section that you put in your shopping cart. But if you're second day or third day, um, then um, you may not. So the last thing you want to do is have your enrollment window open. You go into the system, you look at your shopping cart, and then you got like multiple sections that are now waitlisted. And now you have to go search for a class, find one with a seat available, and then enroll in that. Because the time you spend doing that, other students who already have classes with seats in their shopping cart are already pressing just the enroll button and they're enrolled in it. And so that seat may be gone by the time you get back to try and put it in your cart and enroll in it. So, and I'll be going over this a lot more once we get to it, but that's the normal enrollment process. You have the shopping cart period where you put all your classes in at various dates and times so that you don't have anything overlapping. And then when your enrollment window opens, you hope that the seats are still available. If not, if they're waitlisted or closed sections, you have to go and find another section with a seat. Block scheduling eliminates that because the registrar's office will automatically give you a seat in the Bio 204 with lab class, the Chem 140 with lab, and calculus if you have an AP'd out of calculus, and the Pharm 100. So when your enrollment window opens, you will already have a seat in those classes. You won't have to worry about searching for them or enrolling in them. You'll be already enrolled. You'll only have to put in the shopping cart whatever other 3 credit course that you want to take. So hopefully that made sense. Um, if not, let me know. And can we email the slides out? Yeah, just send me an email if you're interested in the slides, and then I can send you a PDF copy of the slides. I know this is a lot of information, but again, don't worry. We'll be talking more about it if you deposit. Like we'll have another formal new student meeting, Zoom session, like after the deposit deadline. Well, I'll be going over all this stuff again. Okay, what time are we? All right, let me keep going here. So pre-pharmacy advising. As I mentioned, I'm the advisor for you guys. And these are all the things that I take care of as an advisor. The class scheduling, as I mentioned, like if you aren't able to find a seat or all the seats are gone, I will work with the department chairs to get seats added. And believe me, no one else at Chapman has that benefit. If you're just a regular chemistry student or biology student, you can petition to try and get into the class, but nothing's guaranteed. But I will find you a seat in some class. Um, so that you can take it in the fall. And that's especially for the science classes. If it's calm and all the seats are gone and calm and you haven't taken English yet, then I'll say, look, just take English instead of calm, right? But I'm talking about for those that you have to take in order to be able to take the next class in the series. So like biology and then genetics, right? And then microbiology and then physiology and like Chem 1, Chem 2, OChem 1, OChem 2, like those that you really need for sequencing. Those are the ones that for sure I will get you in. The ones that you have other multiple options on, then we'll work with the multiple options. But you'll get seats in classes, keep you on schedule. But I am here to help you with professional skills, connect you with campus resources. I do track your academics. So in the middle of each semester, when I meet with you to talk about your classes for the next semester, I'm also checking in to see how you're doing academically. Now, if you have been struggling academically, I hope you would have notified me when you first started having struggles so that we can try and intervene and get you back on track. But for sure, at the midpoint of the semester, like after midterms, I'll be meeting with you and you'll hear me ask the question, what's your lowest grade? Now, if you tell me your lowest grade is 92, then we move on to other questions, right? But if you say your lowest grade is 82, then I'll be like, okay, what's your and what class is that, right? And then what's your next lowest grade? And so I get a sense of kind of where you are academically so that I can provide some assistance if needed to kind of help you get back on track. And then if you have personal health issues, you can definitely come to me. Um, I know I don't look like it, but I'm a great listener, right? And so I'll be here to kind of help you. Um, and then FERPA, that is like the Student Info Protection Act, basically, which means that all your grades and everything to do with your academic record is your private information. Now, I get access to it, your teachers get access to it because we have a need to have access to it. But your friends, obviously, but more importantly, your parents will not have access. So right now, if you use Canvas or I forget what the other learning management system is out there, there's a couple out there in high school. Your parents have access to it. They can go in, see if you did a homework assignment, see what your grades are. Once you start undergrad, they're cut off. So they won't know how you're doing academically unless you tell them. And then any career advice, we have students who are interested in becoming pharmacy techs. I put them, uh, I connect them with Walgreens that has a pharmacy tech training program that some students are doing. And then if you have questions about various academic pathway options in terms of if you really got excited about nuclear pharmacists, I can connect you with other nuclear pharmacists for you to talk to. But the main thing is, I'm really here for you. Like, I want my job to be ahead of the game, keeping track of everything that's going on, making sure you're informed about what's going on, keeping you as calm and as stress-free as possible. Um, Outside of having to study for exams and do homework assignments, right? I really want you guys, and I have, this is what I do. I make sure that students are able to focus on their studying and a lot of the process and everything else. I'm there to kind of help you with so that you have more time for studying. All right. And that leads to great success for the Apex students. These are the cohorts that have graduated from the Farm D program already. So our first cohort for Apex started in 2014, so 5-year program. They graduated in 2019. And the last one to graduate was 2025. But you can see here that the average GPA for the Apex students in their 2 years of undergrad was 3.6. Um, And most importantly, their average GPA in the PharmD program is 3.54. So what this tells you is number one, the Apex students do really well in undergrad, and that they do just as well in the PharmD program. This program is meant to set you up for success in pharmacy school and beyond because the when you compare Apex students to non-Apex students, the Apex students have higher average undergrad GPA than non-Apex in the PharmD program, higher PharmD GPA than the non-Apex students, higher graduation rate, higher residency match rate, and highest NAPLEX pass rate, right? So that's one of the beauties about this program is that it takes really high achieving high school students and gives them the foundation to be even more successful in pharmacy and afterwards. And speaking of things to do after pharmacy school, if you go into ChatGPT or any of the AIs out there and put in, give me the top 50 pharmacist jobs, you'll get a list very similar to this. So you have traditional stuff out there like retail, hospital, clinical pharmacist, consultant, compounding, managed care, right? Regulatory affairs is in the pharmaceutical industry, right? As is academic, academic pharmacists is like me, professor. But then you have other pharmacists in the industry, nuclear pharmacists. But then you have the clinical specialists like transplant pharmacists, emergency medicine pharmacists, oncology, which is cancer patients, pediatric, geriatric, psychiatric, infectious disease, pain management, cardiology, critical care, right? All of these are going to require 2 years of residency. So you'll do a PGY1, which is a general hospital residency, and then the second year would be a specialty residency in one of these areas to go into those areas. But lots of other things. You got correctional facility pharmacists, public health pharmacists, travel pharmacists, and that's pharmacists that prescribe meds for people going on trips, so like vaccines and other meds to keep them safe when they're in a foreign country that might have infectious diseases. Um, but telemedicine, right, sports medicine, medication safety, academic detailing, that's the other industry position. And so, yeah, like lots and lots of different things that you could do as a pharmacist. I'm sure that you're probably surprised to see these. And again, if you say, give me another 50 and another 50, it'll keep giving you additional items that pharmacists do. Now, it typically goes by the number of pharmacists that are out there. So as you get into like the hundreds and so forth, there's pharmacists doing out there, but maybe not that many pharmacists. But still, there's additional roles for pharmacists out there. And if you haven't seen the Rinker campus at all, this is one table in one of our active learning classrooms. So students each semester they get assigned to a team, and when they're in this classroom 207, they sit at this table. And so usually the professor, when they're lecturing, will have some assignments for the students to work on as a team. And the technology here is this screen. The students can connect their device. Like here, they have their iPads. By the way, you do get a brand new MacBook Pro when you start the PharmD portion of the program to be able to use in your classes and for taking exams. But the point is, this is really efficient use of technology because basically um, sorry, give me a second. Because one student can be connected to the computer and all the students can be on Google Docs and so they're all working on the same document, but it's displaying up on the screen so the professor can walk around, see what they're working on, making sure they're on the right track and so forth. So it provides much more immediate feedback. This is the one of our large lecture classrooms, and the technology piece here is this LCD projector is 3D enabled. And so what that means is that the professor who teaches like medicinal chemistry, they can show the drug structures in 3D. And so it makes it really nice to be able to see the structure. They can rotate the structure and makes it much more immersive than like when I went to pharmacy school or at a lot of other pharmacy schools where the professor might have pictures of it that they put up on the slide, but you really can't get that visual imaging of rotation and so forth. This at the bottom right is our sterile compounding lab. And so this is for compounding of IVs and injections and eye drops. And so you do have a class for sterile compounding and where you'll be using this lab. This is just the antechamber where you go in, you'll have to put on your sterile items like your boots and so forth on this side, and then move over to the other side. Um, and then the sterile room is behind another door here with positive pressure with the laminar flow hood for you to do it. But this is a very high standard. The USP 797 is like the highest standard you can have in a sterile room. So we could actually make injections for a clinical trial if we wanted to. I mean, technically we could make injections to sell, but we're not into like selling medications. But and then this is our non-sterile compounding, one of our two non-sterile compounding rooms. And this room is fantastic because one thing you'll notice, we don't have long benches. We have these tables. So the students all sit around the table. We have five at each table with equipment for each. And so you can actually communicate. Because if you think about your chemistry lab or biology lab, you got people on either side of you, but not really as conducive to teamwork as this setup, number one. Number two, at pretty much every other pharmacy school in the US, when the students are working on something that is going to put off a strong smell, they have to go and line up in front of this fume hood to work on their compounding item, much like you probably do in chemistry class, right? When you're working with Bunsen burners or something hazardous. But that's so inefficient because you could only have like one or two students in the fume hood at a time. But what we have are these domes that you can see here that the student can pull down over what they're compounding, and they hit a switch on the side there, and it sucks the fumes out. So there's two of those at each table, so you can have two students working on something at the same time for each table. And then the really best thing about this non-sterile compounding, believe me, is this black thing up in the top of the ceiling, which is a camera, which is like a cooking camera, right? For cooking shows where they show down into the pot or the skillet. The beauty of this is that the professor can be up here at the front desk and be demonstrating how to mix creams, ointments, make suppositories, tablets, troches, whatever they're working on. And the students can be back at their desks viewing it through the front TV screen, or we have TV screens in the back, and be doing it at the same time. At every other pharmacy school, like when I went to pharmacy school, when the professor says, "Oh, I want to demonstrate this technique," all the students have to run forward to the desk and hopefully, if they're short, be able to get in front of everybody else. But you're looking over people's shoulders, and then once they finish the demonstration, you got to remember what you saw, come back to your bench, and then replicate it. But here, the professor's able to demonstrate it while the students are at their table and able to do it at the same time. So it makes it extremely efficient. All right, we got another question. How many students are admitted this year to the Apex program? So basically, our target enrollment is between 60 and 65 students. So that means we're expecting 60 to 65 students to accept our offer. Obviously, we admit more students because our yield rate is around 38 to 40%. So 38 to 40% of students that we offer admission to accept that admission and deposit and start the program. And so we'll admit over 100, maybe 120 or something like that to get our 65. Can't do the math, but yeah, that's the answer to your question. Now there's time for more questions. So I wanted to leave plenty of time for you guys to ask other questions, other concerns that you might have. So please, this is your time. Um, so I know we get a MacBook on our third year when you start the PharmD program, but what do you recommend for the 2 years before, MacBook, Windows, or Chromebook? That's a very good question. Um, if you have a laptop already that, you just got or is still in good shape, you can keep using that, whether it's a Mac, a Windows, or a Chromebook. Like what you use in undergrad, really you can use whatever you want. Now, the one benefit of using a Mac in undergrad is that you can prevent having to learn how to use a Mac while at the same time you're learning your pharmacy classes. Do you know what I mean? So if you've been using a Mac in undergrad, you already know how to use a Mac when you get your new Mac in pharmacy school. If you use Windows uh, or Chromebook, then once you get your new Mac, you'll kind of have to learn how to navigate where stuff is, all that kind of stuff. It's not a huge learning curve, but it is a learning curve. So if you're wanting the most seamless transition, then going from Mac to Mac would be the best. But again, we have plenty of students who use Windows in undergrad and then switched over to Mac. So it's your preference, what you want to do. But good question. Other questions? We still have about 5 or so minutes. If I'm behind in math courses, would taking summer courses be the best option before attending? As right now, I'm currently taking trig due to my school course pathing, and it will be the level of mathematics that I graduate with. Yeah, good question. So, and I'm going to say a couple things about math. So I'm glad you brought that up. Yeah, like if you're in trig right now, I highly suggest taking pre-calc at a community college over the summer just so that you are better prepared to go into calculus in the fall and do well. Um, One thing that you will have to do, like say you deposit like in late May, you're going to be required, all Chapman students are required to take a math placement exam. It's a 25-minute, or sorry, a 25 question exam. It's online at home, right? There's practice exams you can do, but basically, once you start the practice exam or the placement exam, you have to complete it. If you get 20 out of 25, 20 or more out of 25, then you're able to go into calculus. If you get 19 or less on that placement exam, then you would have to enroll in what we call Math 101, which is like a calculus prep class. And do not view that negatively at all because believe me, it's in your best interest. Before we went to this method, we had a bunch of students, not a bunch, but we had students that would come in not prepared for calculus and would get less than a C in calculus first semester, they're out of the program, right? So it's better to get your calculus prep if you're not really ready uh, for calculus. Another group of people that I would say would probably benefit from taking Math 101, even if they got like a 20 on the math placement exam, would be if you haven't had calculus, well, if you had like pre-calc in your junior year and you're not taking calc in your senior year, right? If you had calc AB or BC in your junior year, you're probably okay with going into calc. But if you only had pre-calc, I've noticed that some students that were in that situation, they struggled in calc to start off. And you will hear me say this multiple times, so I apologize. But if you're in calculus, if you end up taking calculus, Math 110, and in the first week of class, you're sitting there and you're like, I literally have no idea what they're talking about. Let me know so I can get you moved to Math 101 because we've had students try to get through it and almost to a T, they end up getting less than a C. And it's not worth it when you have the option in the first 2 weeks of class to be able to drop one class and then go to another. So thanks for that question. All right, let me answer these last couple of questions. Able to provide more information about the summer travel courses. Yeah, we have a brochure that's going to be coming out for this year. Um, that has information with the itinerary of what we're going to be doing. And so if you email me, I can make a note, and then once that brochure comes out, I can uh, get you on through email. Let's see here. Is it a pretty smooth transfer to start the PharmD at the Rinker campus after 2 years in pre-pharm? Yeah, it really is because you're going to have that whole cohort of other Apex students that is moving over with you. And that's number one. Number two, as an Apex student, you're going to have exposure to some of the PharmD students and like even before you go to Rinker, so you already know some PharmD students. They'll be second years when you start as a first year. Um, so yeah, the transition is really smooth for Apex students. Minimum grade requirement for courses in the Apex program. Yeah, I went over that before. So basically, to remain in the Apex program, you need the cum prereq GPA of at least 3.0. You can't get any grade below a C. That's automatic dismissal. And if you have a semester GPA below 2.6, that's automatic dismissal. All right. Okay, lots of questions coming in here. What type of pharmacists do most of your previous students become? I mean, a lot go into community, but we have a lot that go into clinical pharmacy roles, whether it's emergency medicine or infectious disease or cardiology or what have you. But then we have some that go into industry. We definitely had some Apex students go into the pharmaceutical industry. So it's a wide array of students. Ambulatory care is another area that students go into. Do you still have to take the math placement test if you received an AP score on calculus that opts you out of calculus? Thanks, Sabrina, for asking that question. No, you do not. If you fulfilled calculus through a community college course or through IB or AP exam score, you do not have to take the math placement except in the situation where you just took the AP exam um, this year, right? And so if you took the AP exam, that score is not going to come out until July. And so in that case, you may know the score that you got, but because the official scores don't get to Chapman until July, you'll still need to take that math placement because that math placement needs to be done like late May, early June. And so if you took AB and you have a sufficient score, if you took AB after junior year and have a sufficient score, it doesn't matter if you just took BC because your AB will work. But if you took AB in junior year, didn't get a sufficient score, you took BC senior year, but your score hasn't come to Chapman yet, then you would have to take the placement. But if you take the placement and your score comes in and you did fine, then it doesn't matter. You won't have to take calculus. Any additional requirements other than just passing the necessary courses in order to go from pre-farm to farm D. Not sure. Well, the classes and the GPA requirements are the main requirements. Obviously, you have to um, submit an application to the PharmD program in August, by August 20th. In the summer between your first and second year, you have to go in and do well on your interviews. So that's another requirement. And then once you finish your pre-farm over that summer, there's a lot of other requirements that you'll have to do to start the PharmD program. So you're going to have like a drug screen, a background check. You have to have your vaccinations up to date. Um, so there's a bunch of other things that you have to submit your board, your intern pharmacist license application to be able to get your intern pharmacist license. So, but the pharmacy school will be communicating with you about that in the summer before you start the PharmD program. So those will be other requirements. Um, so scholarship renewal process, upon accepted admission, I was allotted a guaranteed 2 years for scholarships and a recent scholarship as well. But after 2 years, I'm unsure how my aid will look. Yeah, that's a very good question. So since you're an Apex student, you only get 2 years of undergraduate aid because you're only an undergrad for 2 years, right? So any merit scholarships or any FAFSA-based scholarships, whether it's a Chapman grant or Cal grant or Pell grant, like all of that money goes away once you finish your 2 years of undergrad. And then once you start the PharmD program, you'll get the $44,000 scholarship, which will be 5,500 per semester. And then you have like outside external scholarships you might be able to apply for to help with costs. But then for graduate school, for pharmacy school, which is graduate school, basically, it's student loans for the majority of it, or parent pay in that case. To keep your scholarship for undergrad, I think the minimum GPA is 2.4, 2.5. Don't quote me on it. But for pharmacy, like it's 3.0 that you have to maintain to keep your scholarship during the PharmD program. And then you have to keep 3.0 to stay in the Apex program. When will financial aid packages be released? I have no idea, but should be before May. But um, if it's March or February or April, it just really depends on the government and how quickly FAFSA gets the information out to the universities. The math placement exam is online, so you can take it from home, and you can take it whenever you want. So it's up to you. You just have to take it by the deadline, and we'll communicate with you. So when for students who deposit for the Apex program after the deposit deadline, a couple weeks later, I'll be sending an email that will have a document that lists what things need to be done and by when over the sum from that point until classes start, so that you're very clear on what you need to take care of before the semester starts. All right. The last thing was uh, if you want to book a meeting with me to ask any other questions at any time, you can use this link. I'm going to put this link in the chat. Uh, and basically, you can just click on this if you're on your phone, and then it'll open up in a browser, and you can bookmark it so you always have it. But basically, when you click on that link, it takes you to a web page where you can schedule a meeting, either 15, 30, or 60 minutes, and either in person or virtual. All right. Any last burning questions before we go? All right. Well, I wanted to thank you guys all for coming. We definitely had a good turnout for our first admitted student day. I'm going to have another one after the regular mission decisions go out in mid-March. And so you don't need to go to that one. You can go to that one as well if you want, since you've already, because I'll be given the same information. But if you deposit, like I said, I'm going to have some info sessions for the incoming students, like in late May, early June, to give you all the information that you need to know to get through the summer and be prepared to start in the fall. So with that, I will bid you adieu. Uh, and yeah, glad it was helpful for you guys. And if you have other questions, like I said, you can either email me or you can, set up a meeting, and I'll be glad to answer any questions you or even your parents might have. Like until you start the Apex program, I can talk to your parents. After you start the Apex program, I can no longer talk to your parents. So it's a good opportunity to be able to get the information that you need. But you guys take care. I will hang out in case there's some people that want to hang on because they had a question that they don't want to ask in front of 20 million people. But otherwise, if you've had all your questions answered, I will see you next time. It was good seeing you.